Back in December, in my lab, I had a junior ask me if they thought we would be hurt by COVID. I had lived through scares, swine flu, bird flu, SARS, MERS, even Ebola. The government had always been on top of it. Even George W., who I completely loathed, stepped back and did what the scientists said to get that hero status of a job well done. So I quickly dismissed the idea that it would suck for the people of China, but not for the rest of us. Well, I was wrong about that, as China denied it and ended up letting it escape, but that didn't mean it would be more than anything of an annoyance to the US. Just a heads up, I'm a microbiologist. I have worked with deadly diseases, and since I know how, I have no fear of the diseases. I work at max with BSL-2, which means non-airborne, and I'm not afraid of the diseases I work with. With some diseases I've worked with, a wrong civilian move could end me up in the hospital, or in the cases of HIV, have an infection for life, but since I know what I'm doing, I never have a fear of them. The max I would work with is BSL-3, as there are always over-engineering set up to protect you from infection. By the way, that's airborne. BSL-4 is so dangerous, like Ebola, that the tiniest slip-up could kill you, and I don't have that kind of focus. There is no wiggle room. This is why I don't fear COVID, usually. But only because I follow protocol just like in the lab. Live with a slight inconvenience, keep aware, and there is literally nothing to fear. Simple, right? Then Maddow started covering all the things Trump had done to our disease and pandemic defense, as well as so many other things that just break everything I was taught in school, and fear started quickly rising. When I discussed this all with my fellow biologists trained in how disease spreads, you could just see their faces twist in horror as, "You don't do that!" But it didn't matter. We all had a pretty good grasp on history of disease and just how bad things could get, and the knock-on implications it could cause. The general public, however, didn't. For the first 3 to 4 months, we were all in this together. We all knew flatten the curve, social distance, wear a mask, wash your hands. The dictator of no, Moscow Mitch, even allowed a much-needed stimulus package, mostly because it helped the very rich get richer in hindsight. NPR and the other places aired discussions on the closest event in history, the Spanish flu. How the first spring and summer was bad, and then by the end of the summer, people wanted to ignore it, and they held an end of World War I parade, and the end of the flu parade, where they all symbolically took off their masks at the same time, and more people died than the entire war. There's an entire section in one museum here in Philly about our massive failing and death toll our parade caused. What a bunch of dumbasses. We'd never repeat that mistake, right? Yeah. Early cooperation caused by fear and uncertainty made me hopeful. We all followed the rules and worked together. Or the cities, I should say. Rural regions were barely impacted, especially since travel was reduced from those cities. But then as people became locked down, they were stuck inside with the internet, and all forms of insane conspiracy theories spread. QAnon, Bill Gates microchipping, 5G, and anti-science all came out of the woodwork, and the Trump cult he had so carefully created began to sell more alternative facts, a convenient lie instead of the inconvenient truth, and people ate it up. But we should have seen this all coming with all the apathy towards school shootings. Near the end of the Carter term, he sat down with the American people and treated them like adults, telling them the truth about oil unsustainability and how we needed to begin conserving energy and tamp down on our expectations on growth and begin shifting away from fossil fuels. Supposedly, this actually rated quite well with the American people. But then Reagan came along promising that using trickle-down and supply-side economics, everyone could just have everything they wanted and not have to sacrifice anything. And people jumped on it, stripping out the middle class entirely. Climate scientists did the same thing, and fossil fuel companies sold us a completely different narrative of reality, that everything was fine and the greedy scientists just wanted to make more money somehow, and you don't have to change a thing about your world. A subsection of this nation has been programmed to ignore reality for corporate reasons. It's only natural for them to have jumped on this new convenient lie. Even better, Trump created an us versus them narrative that it was actually the evil governors who are violating the Constitution, even though your right to swing your fist ends at my face, and if your breath can potentially kill me, it's legally the same thing as your fist. I remember as the summer wore on, when I would go for a walk, more and more people would try and pass me without a mask, and it would make my blood boil. People in stores would show up angrily shouting at managers and underpaid store clerks because, "I'm sorry, I thought this was America." All the while, people died away from their family and friends, scared and alone. I even worked my ass off to help 3D print about 90 face shields for hospitals when they were at their worst, because Trump didn't bother to make sure things were available. And for what? So these people could walk around me without a mask, looking smugly that I was just a scared little bitch sheeple for wearing a mask and doing what the imaginarily well-paid scientists said blindly. As times wore on, I just learned to turn my back to them and let them walk by so any droplets containing thousands of virus particles would hit the back of my clothes and have time to dry, mostly protecting me. All while having people argue with me online about how masks didn't work, because in their minds, viruses become airborne like dry spores on the wind, and just one virus needs to infect you to cause disease. Even though it's the fluid dynamics of droplets, my mask doesn't protect me, it protects you. It takes a few drops of your airborne saliva filled with thousands of virus particles to be inhaled by me to cause infection, and not one stray dry particle of a virus floating around. Then Trump started spreading even more BS, first claiming it would just go away, then hydroxychloroquine, which ended up killing some people, which he had a stake in, then the idea of injecting cleaning products, then on the bastardized version of herd immunity, which is pretty much just a terrible abuse of the theory of natural selection, while somehow magically isolating the vulnerable, citing Sweden as an example where they have universal healthcare, a strong social safety net, and civic responsibility, and even then they had to abandon the practice because it's still too many deaths. In other words, in practical terms, in America, it's the idea of Hitler's useless eater, where the old, sickly, and disabled get killed off to create more resources for the fit and the strong, which is why I've personally referred to Trump's reaction to this crisis from the beginning as Operation Useless Eater, and it's going very well. Just a note, herd immunity is a system where everyone who can get vaccinated does, and since it requires human bodies to spread the disease, if a certain percentage of the population gets the immunization, the vulnerable are protected because there's no disease to spread to them. Not, let's kill 1 to 2 million people so it becomes endemic in the population, so let's have a big COVID orgy and try to catch it as soon as possible, because it's gonna happen anyway. The thing Republicans berated gay men for doing when it came to the AIDS crisis. 10% of people just genetically are susceptible of getting hit hard by the virus and can die from it no matter how healthy they are. And no matter how careful, care workers can still bring the virus into a nursing home, massacring them. But then the comorbidities claims came out, and then the belief that doctors get paid more for COVID deaths, so they mark everything as COVID deaths, when if you even know the basics of how doctors mark and track causes of death, this is ridiculously laughable. But then these are also the people who use the chewed gum argument to shame kids into not having premarital sex. You can't understand that being a large group of people or not being perfectly bubbled away from other people is the epidemiological equivalent of an orgy these days. I'm betting the same people who refuse to wear a mask are also just expect to not have to wear a condom with someone they just met and get mad if they're asked to do so. Then Trump got the virus, and after $10,000 of treatment insurance companies sure as hell wouldn't pay, and experimental treatments no one else had access to, he came out and claimed that anyone could beat it, and it wasn't a big deal. Senators and congresspersons who caught it refused to quarantine. All the while, I was believing Americans would see the hypocrisy and idiocracy, especially once they and their loved ones got it. I was certain that once someone had a death in their family from it, suddenly they would take it seriously. Boy, was I fucking wrong. Enough people did vote to unseat the president, but not the Congress. Trump's numbers were not down, but up in areas hardest hit with the most deaths. As of this day, doctors are reporting that people in the hospital on ventilators are refusing to believe they have COVID or that they will survive it as they die. I mean, denial of facts probably makes for a better way to die because they never knew they died, but seriously, Trump murdered these people's family members and they still voted for him in droves. How brainwashed do you have to be? Trumpism is a death cult that makes Jim Jones look like child's play, though the gamification of gambling involved with it probably helped a lot and made it more enticing. In fact, the number one thing you hear from people who refuse to take precautions is, "I don't know anyone who's died from it," or caught it, so it must not be that big a deal. That's the freaking point. We don't want you to lose family members. And if a preventative action ends with no tragedy, it means it's worked. But non-tragedy becomes like breathing air and taken for granted, and the brain is naturally terrible at dealing with risks or statistics. Also, the deaths are clustered around the poor and working class that you seem to like to actively expose them to disease and make life worse for them. Eat the poor. I have a coworker who tries to tell his family to stay away from their grandmother. She's old and has lots of health factors. They refuse, all thinking it's not a big deal. Like, do they hate her or something? They treat him like a nervous Nelly and a rude killjoy, even though he's literally spent 4 years learning about this stuff. Even people who take it somewhat seriously are bad at thinking about it. Some people take risks and rationalize potentially exposing others and not quarantining because it's essential work or had something to do with the election or protests. That is great and noble. When asked to quarantine or bubble away temporarily to protect others or at least the vulnerable, they get mad and offended. The virus doesn't fucking care how noble you're being. Quarantining isn't a punishment, it's a safety precaution to protect others because you supposedly care about them. But studies show that people are less likely to take COVID precautions around people they trust because they wouldn't purposely infect you. That's the point. They wouldn't knowingly infect you except for the Covidiots who actually try and catch it. The disease can be asymptomatic and still spread, but people treat it as rude if you dare question the idea or ask them to temporarily restrict their own freedoms to protect others after constantly repeating that they would do anything to protect others or the country, except apparently wear a little piece of slightly uncomfortable cloth. If we had real, free, adequate testing for antibodies like many other functioning nations, this wouldn't be as much an issue, but we don't. Even non-emergency room doctors and nurses are being denialists. A coworker went to a physical and the doctor not only said she wasn't getting the vaccine, she completely believed in the Bill Gates BS microchipping conspiracy theory, like a microchip could somehow track you better than the phone you willingly carry, or maybe it's a brainwashing chemical like fluoride or chemtrails are supposed to be. Who knows? Healthcare workers are like weather reporters to climate scientists. They are forward-facing and are a jack-of-all-trade, master of none in their field. And doctors are often statistically arrogant as fuck because the doctor is the highest peak of big braininess in the public's mind, aside from superstar scientists, which is way harder to accomplish. And when you're arrogant, it's very easy to get sucked into BS, especially when you aren't consistently keeping up with the science. But since they are forward-facing and had legitimacy to the average person, the research scientists who have data at hand don't, because they're out of sight, out of mind, and easy to vilify, people get a lot of bad information. I also had a nurse who claimed she wasn't getting the shot, and I don't know how many nurses have been used as anti-science, anti-vax claims if they have some sort of authority on anything. They're a tech worker compared to the engineer. They are hard workers and serve a vital function, but they can easily go beyond their area of competence and use their perceived authority as some form of inside scoop on the truth. And here we are. At the beginning, my empathy was skyrocketing. At this point, it's either tanked or will mean massive depression to the point of suicide. I literally just can't care. My heart is already too exhausted going out to the emergency health workers, many with clinically diagnosed PTSD from all the death around them they helplessly are unable to stop, and doctors and nurses are having to quit their jobs after 6 months with things not getting better but worse because of burnout and fatigue. They could handle it when there was light at the end of the tunnel. There is none for them now. Now they have to focus on themselves and may or may not return when the vaccine comes out, as so many aren't going to take it out of fear and anti-science paranoia, making going maskless unsafe until somewhere around 2022. A little restriction of your own freedom could have sped up the recovery and made us all free, but instead masks were slightly uncomfortable, and a video on the internet told you that masks help spread COVID, so now we have to wait 3 times as long till everyone can be free, while your fellow Americans drop like flies, and that goes double for the poor ones. At this point, healthcare workers are so overwhelmed and exhausted, a nurse reported that there's an area in their hospital for the very worst cases called the pit, where there are no doctors, they are busy saving the manageable lives they can save, and barely. The people in the pit get 3 resuscitations max, after that they let them die. This kind of barbarity only happens during wars, not in supposedly civilized nations, and they have no choice in this matter. My heart goes out to these brave healthcare workers. My heart goes out to the people who tried and still had family members die alone and scared. That's it. I no longer have the mental and emotional space to give any more fucks about these idiots who have been given every single chance to save lives and refuse to do so because they believe they can magically beat it if they just freed them harder. Philly's going into an almost complete lockdown again until the end of the year. We're following the Spanish flu verbatim. It's going to spike even worse after Thanksgiving because apparently they need grandma to be a human sacrifice for their cult of denialism, and it would be rude to rock the boat and not go. Nothing about my life is going to change. I'm bubbling with the people that matter to me, and so are they. We're going to work in our safe conditions, which is a privilege. We are following all the protocol we were told from the beginning. I'm doing all I can and helping in a minor but not insignificant role on vaccine manufacturing for COVID. And I'm just focusing on us because I literally can't do a single thing to help others in this scenario. Focusing on my own mental health and going through 2 months of mindfulness meditation track now that the Covidiot in chief is finally defeated, and I've been successfully convinced there is no way he won't be out of the White House after January 20th, causing more chaos, and the second he's out of politics, Twitter will block him because he's no longer a politician, and he will have to scream to his flock on Parler or MeWe or probably Facebook because Zuck is basically a fascist too. I remember in Futurama where they referred to Fry's era as the stupid ages, and we all laughed thinking he was referring to the W. Bush era. My God, we had no idea it would get this bad. I'm done. I'm relaxing for the first time in 4 years. I'm getting my stress levels and emotions under control for the next big fight so I'm actually useful in it. Stay safe, wear your mask, social distance, bubble with your loved ones, quarantine if need be, not as a punishment but as a way to protect others, wash your hands and focus on your own mental health. All you can do. They can't eat our empathy up anymore to our own detriment. They are what they are. That said, for this Thanksgiving, I am so thankful that my family has decided not to get together for the holidays and make grandma a human sacrifice. I saw the emails coming in and was really nervous to open them. There's a lot of pseudoscience in my family and I am constantly trying to counter, but this is one that for me luckily didn't stick. Most probably won't get the vaccine, but at least they're not stupid enough to ignore these warnings. So I'll eat my Thanksgiving and Christmas meals bubbled, knowing they are at least mostly safe without worrying if I'm going to have to attend a Zoom funeral after next year. These years, the bright spots are few and far between, and this little bit of sunshine, as low a bar as it is something worth celebrating.